No two people with degenerative arthritis will need exactly the same treatment, and any treatment plan must be tailored to the individual patient. That said, any good degenerative arthritis treatment plan will almost certainly include the following. Medication. In most cases, you'll find that over-the-counter or prescription painkillers in the form of analgesics or non-steroidal anti-inflammatory drugs will do the trick, and the secret is to take just what you need and no more. Your doctor will work with you to find the correct medication, and if neither of these classes of drugs proves effective, then there are others that can be recommended. Exercise. Although it may seem strange to be exercising a painful joint, and perhaps more sensible to rest it as much as possible, in fact, exercise to keep the joint lubricated is essential to slow down the progression of the disease and give you the maximum use of the joint. Now, you must of course be careful when it comes to exercise, and you need to ensure that your exercise is having a positive effect and not doing further damage to your joints. So for this reason, you should seek professional advice from your doctor when you're putting together an exercise plan. Any exercise plan needs to include exercises to improve flexibility, to strengthen your muscles, and to improve your endurance by strengthening your cardiovascular system and improving your overall health. Joint protection provided by ensuring the correct alignment of your joints. To ensure that no further or future damage to your joints is done, you need to pay particular attention to your posture when, for example, sitting, standing up, walking, running, or lifting. Incorrect positioning of your feet when standing up from a chair, or incorrect positioning of your back when lifting a heavy object from the floor can easily damage or weaken a joint and lead to further or future damage. With already affected joints, you should consider such things as using strapping to support the joints, or taking weight off the joint by using a walking stick, a walker, or crutches. Other tricks include breaking activity up so that you have short periods of activity interspersed with rest, rather than one extended period of activity. You can also look at varying your tasks throughout the day so that you're not concentrating your activity on any one joint for too long. The application of hot and cold compresses. The pain of degenerative arthritis can often be eased by applying either heat or cold to the painful joint. You'll need to experiment to discover which works best for you in particular circumstances, because some people find that heat works while others find that cooling is better. Now, whether you're applying heat or cooling your joint, you should not do either for more than about 20 minutes at a time, because prolonged heating or cooling can itself damage the joint further. The removal of unnecessary weight from your joints. If you're overweight, then you're putting an unnecessary strain on your hips, your knees, and your feet in particular. And even a few pounds of extra weight can make a significant difference to the damage done to the joints, particularly to those of the knees. Shedding those extra pounds can make a very real difference to your arthritis and, of course, to your health in general. Positive self-help. A knowledge of how you can help yourself is essential. There are many things that you can do for yourself to make your life easier and to manage the pain of your arthritis, and you do need to take some time to learn how to cope with degenerative arthritis. Positive thinking, massage, relaxation exercises, prayer, diet and dietary supplements are just a few of the many things that can help. And you need to learn how you can use these things and then experiment with their use to see just what you do find helpful. Finally, do not forget that if despite all your efforts in putting together a degenerative arthritis treatment plan, you still find that it is difficult to cope with your arthritis, then one further possibility which you might like to discuss with your doctor is that of surgery. If you'd like to find out more about degenerative arthritis, then visit arthritisquestions.org today.